Hey everybody, Dr. Toni Ingram here, and we are about to do a little chit chat and get to know Dr. Brandon Bright. So I'm super excited to meet him and learn a little bit about him, and he's wanting to talk all things oral systemic health. So let's see how quickly I can get this done without looking like an old lady. Ted. Hi, Nikita.
Hello.
Dr. Bright, hi.
Hi.
How are you?
Good. How's it going?
Good, good, good. And it's Brandon, right? Is that your
Yeah,
first? Okay. Awesome. Well, so nice to meet you.
you too.
I'm looking forward to this. So your audience is maybe perhaps looking for a little bit of info on oral health, right?
Yeah. Yeah, I get a lot of questions about biological dentists, oral health. I have it on my intake, and one of the things I take too, they're really big into oral health, all the oral infections and stuff like that. Chinese medicine has each of the teeth are correlated with different organs, so depending
Mhm.
on, which infection you have or where it is, could be affecting that organ. So I have on my intake any root canals, any amalgams, anything like that. Just keep in mind something that often gets overlooked, doesn't get asked about, and that hidden infection can cause so many different things that you can't figure it out. You can't quite get to that next level with them, and it could be something as simple as that.
I love that you're screening for it with your patients.
Yeah,
Is that because is your practice, do you practice Chinese medicine in any way, or you're just one of the
I
smart
do.
ones who realizes, okay, awesome.
Yeah, my doctorate's in Eastern medicine and acupuncture, and then I do a lot of the functional medicine stuff too. And then one of the guys I follow for electro acupuncture, we do a lot of microcurrent. Dr. Jamie Steiner, his father was a dentist, and so he's really big into the whole oral part and treating different things if they have cavities. Basically, recommends getting the cone beam scan, stuff like that, to see if there's any infection in that area after like a root canal, and then treating it that way.
Awesome.
And
I
then
love
also with the
that.
amalgams and stuff, if I test there's mercury, there's something like a trimercury test I'll often have them do from Quicksilver to see
Yep.
if it's coming from the teeth or if it's coming from fish. Often, if it's not coming from the teeth, I tell them not to mess with it until it is a problem.
Yeah.
Uh, but yeah, definitely a big thing, especially with these older patients that have had, sometimes 10 different amalgams and stuff in there over the time.
Yeah. So do you have what part of the country are you in?
I'm in Orange County, California.
Okay. I'm trying to remember who the biological dentists are in Orange County. I know there's got to be at least one. Do you have one or two that you refer to?
Not as much over here. But yeah, I
Okay.
am always looking for new referrals and stuff if you have any out here. I get asked a
Yes.
lot, so I have to.
I know Dr. Sonda Moldovan is in, let's see, where I'm going to sound really like a real dumb
Yeah,
Texan. Where is Orange County? How close is LA?
it's
Is LA
it's in
close to?
between LA and San Diego.
Okay.
Yeah, so it
Just a
depends where in
little thing.
LA and the traffic time, but like
Right.
45 minutes to an hour usually to kind of different parts of LA.
Okay. Not too bad. So yeah, so Dr. Sanda's out there and she's amazing.
How do you spell it?
Um, Sanda and
Okay,
Moldovan, Moldovan.
okay. Yeah, I'll just look for her for sure. Yeah, I always have people
She's
asking me
lovely.
different things like that, so I have to look it
Yeah,
up
yeah,
online and stuff, but I haven't been to them to know kind of what
right.
they've been doing. Yeah.
Yeah.
So
So, what would you say is the bit, or maybe there's not just one thing, but what would you say is like one of the primary things you see going on in the mouth that is blocking patients from getting well the way that you want them to get well?
different oral infections, definitely things from root canals I'll see quite often causing just kind of a low inflammatory response consistently. I'll get anything from also a lot of cardiovascular stuff. First thing I always ask them if they've been using mouthwash, depleting all that bacteria, depleting their nitrogen, decreasing their blood flow. So I'll get everyone off of mouthwash that's having
Mhm.
any issues with that, and getting on some nitric oxide boosters to help.
Mhm.
But yeah, a lot of people are really surprised with that. No one told them that it increases any cardiovascular issues.
Yeah, and there's one that it still is like the go-to prescription mouthwash that dentists prescribe after surgical procedures.
Yeah,
And that one is well known to increase blood pressure. So not only
yeah,
is it killing all the good bugs along with the bad bugs, but it has a pretty clear side effect of raising blood pressure. So
yeah,
if a patient's not aware of that, or if they're already struggling with high blood pressure, then they could be making things worse or causing them maybe to even need more medication than they would normally need just from using a mouthwash, which is
yeah.
so silly. Um,
Is there anything that you'd recommend instead of like a mouthwash?
well, so it depends on the use. Now, when we're talking like post-op after surgeries where a lot of times that prescription one is used, there's a really good brand called Stella Life that
Okay,
has clean ingredients. It's like a homeopathic type of remedy in the rinse, and it comes with a rinse and a gel and like a spray. And so I really like to use especially their surgical kit, and you've started a few days before surgery and then keep going after the surgery is done, and it helps with inflammation. It's actually been shown to lessen the need for pain medications after different dental surgeries.
okay,
So that I really like their products, and that's a great way to use it is after surgery. But if we're
yeah,
talking like your run of the mill gingivitis, gum disease, that sort of thing, then yeah, I definitely want people to avoid using anything with alcohol in it,
yeah,
because and like a lot of these mouthwashes, especially the stuff in the big box stores, is just super acidic. Has a ton of alcohol. It just has a whole ton of weird, crazy ingredients. Um, but some like I will use different types of mouth rinses strategically for a short period of time if I'm needing to really knock down the level of pathogens in somebody's mouth.
hmm,
But for everyday long term use, then usually the answer is nothing at all, or we stick with stuff that is much more gentle, like either oil pulling, or we'll do something that has like some salt water, some baking soda, some xylitol, things that are gentle and aren't gonna just crush the microbiome.
yeah. I'll use some like ozonated coconut oil once in a while. Kind of do. I'll put it in my mouth and then shower with it, and then spit it out after,
Yeah,
and do that.
I like
Because
that
I definitely found it's a little bit gentler than doing any of the harsh ones.
for sure. And it could be just as simple as salt water sometimes. Like
Okay.
it Salt water will decrease bacterial levels and will help with inflammation. So it doesn't have to
Yeah.
be fancy or complicated at all.
Yeah. What are your thoughts on root canals?
I have lots of thoughts on root canals.
Do you think
I tell
they're
you,
ever truly safe, or people should get them, or just avoid them at all costs?
it's one of those things where there's a lot to it, and I don't like to have a blanket answer for everybody because I think the answer is different for every person in every situation.
Hmm.
I think it will create a slight inflammatory response in the body. It creates a bit of an immune response in the body. And for some patients who are doing really well and don't have any chronic health issues, sometimes people are able to handle that burden really just fine. And it makes more sense for them to keep the tooth as opposed to lose it. Some people, that's not the story at all. That is the one thing that can trigger chronic symptoms, chronic illness symptoms.
Yeah.
So it is not without risk, but I'm also not going to say that you should have all your root canals pulled, or if a tooth ever needs a root canal, you need to pull it. I think that is probably the answer that I would choose for myself. I would probably choose to pull a tooth if I could reasonably expect to, we're all a little bit vain. Like where the tooth is in the mouth is also, it's not nothing. Like there are
Yeah.
aesthetic concerns that we want to just be able to manage and be careful with, and make sure that we're supporting the body as best we can, making sure that patients are working with people like you,
Hmm.
so that the terrain is healthy. And if a patient chooses to do a root canal, then their body can handle it well.
Do you think a lot of them turn into infections later down the road?
Yeah.
Yeah.
Oh, for sure.
Do you
For
think
sure.
an implant would be better than the root
Again,
canal?
I think in a lot of cases, yes, but not in every case, because
Yeah.
you're still introducing a foreign body into the mouth. And we do the best we can. We choose materials that are as biocompatible as possible. I really like ceramic implants for that, more so
Okay.
than the titanium implants.
Yeah.
Um, but it's still, the body has to be able to handle that that foreign substance.
Yeah. What about for like cavities and stuff? Is there a certain like composite or something that you recommend instead of, some other dentists might, I know there's a lot of different kinds of composites, some a little bit more toxic than others. What's something that you'd recommend they'd
Yeah,
ask their dentist if they had a
I
filling or something needed?
Yeah, I try to keep it again as biocompatible as possible, knowing that nothing is natural that we do
Yeah.
in very little is natural that we do in dentistry. We're doing the best we can with the technology we have available. So the filling material that I use is it's a ceramic based composite material.
Okay.
So it's BPA free. It's the brand is I think the manufacturer is Voco, and the brand that I use most often is in the Admira family of products, and there are a bunch of different ones within that. But even that, like even finding materials that have the cleanest ingredients, sometimes they don't work
Hard.
for
No.
every patient. So if we've got somebody that's highly sensitive, these canary in the coal mine type of people,
Hmm.
then I'll encourage them to get a biocompatibility test first
Okay.
before we even do something as simple as a filling, because it may be that a different composite works better with their body than what I'm used to using. And if that's the case, then then it'll save all of us time and money.
Yeah.
It's,
Is that
right.
like a blood test, saliva? What do they do for the biocompatibility test?
That one's a blood test.
Okay.
Yeah,
It just matches it up against all the different materials and stuff that you guys would use.
correct.
Yeah.
Correct.
Awesome. Very cool. Uh, what else? I saw a lot of studies too with just getting extra cleaning reduces cardiovascular disease significantly. I think they found some of the plaques and stuff from orally also getting to the cardiovascular system, causing some calcifications and stuff too. Something a lot of people overlook for as far as the dental thing goes. I see a lot. I remember a lot of people were getting more wisdom teeth pulled before, and I think less so now. I think they
Yeah.
discovered that it's not necessary if it's not impacted.
Yeah. Yeah, you're
Um,
absolutely right. And I love that trend. Yeah, a
yeah,
trend if we could go towards more natural, doing more of just using the design that God gave us, then I think we're the better for it most of the time.
yeah. And I think, I mean, a lot of people, jaws are getting smaller. Maybe they're more mouth breathing and stuff more recently, causing some of that structural change in there. Luckily, I still have my wisdom teeth. I haven't had any issues.
Do
So,
you? That's
yeah.
awesome. Oh, that's so good.
And then
You're one
those
of the
are
lucky
considered,
ones.
yeah, in Chinese medicine, our fire channels, so our heart and small intestine are connected to those wisdom teeth there. So removing those, and if there's infections or anything in that, then it can affect some of the cardiovascular aspect of
So,
that.
what do you recommend for patients who had their wisdom teeth taken out when they were a kid?
It just depends if there's still infection or anything going on in there. If there's still, I'll do muscle testing and apply kinesiology, and I'll test certain teeth. And if it is coming up as a problem, I'll recommend they get like a cone beam scan or something to see what's
Mhm.
going on in there, like at a deeper level. And then if so, then a biological dentist. I don't know if you guys do ozone or something like that in there to kind of clean up some of the infection. And that alone, I've seen people. Another one I see autoimmune disease from a lot of oral things, specifically Sjogren's, where they get the dry eyes, dry mouth. I'll notice are from they'll have some dental things going on that's causing that mostly.
Mhm. Isn't that
So
crazy?
yeah, yeah.
Yeah.
They're like, what can you do? And I'm like, well, most of the time it's going to be a dental thing. So then we'll work on figure out around what tooth it might be, and then I'll have them go in and do a cone beam scan there and kind of check it out and see
Yeah.
if there's an infection or anything kind of hidden there. Because that's also one of the things that, it could be treating the gut and all that, like you normally do for the autoimmune. It's either going to be like a gut thing, a toxin, a pathogen, or all the above. So normally I would start with the gut, but if it's that, I'll usually have them start with the biological dentist.
So if they, I'm curious, if they have amalgam fillings, like let's say they've got a bunch of amalgam fillings and
Yeah.
some heavy metal toxicity that you're finding in your treatment with them, and they want to do heavy metal detox, how do you start that process, and where in the process do you have them get their amalgam fillings removed? Because I find when I'm working with naturopaths and holistic doctors
Hmm.
that everybody has kind of their ideal time, and it's not necessarily the same as everyone
Yeah.
else's.
I'll start with instead of doing I'm a little wary about using some of the liposomal glutathione and stuff like that that they hold in their mouth and where it's going to leach some stuff out. There's
Mhm.
a transdermal glutathione from Oral Wellness that I've been using that works really well.
Mhm.
So that boosts it doesn't break down into its three parts. You absorb it as a whole molecule, so you get higher doses of the glutathione. And then I'll either use like liver sauce to help with their liver processing, their gallbladder, the toxins, and then a good binder. Quicksilver Scientific is a good company I use a lot. Some of their Ultra Binder or their Pectin, their Amalga Clear is specifically for more of the mercury and amalgam.
Yeah.
So I'll often use that usually after like they kind of get everything removed with a binder. I'll start boosting their glutathione and their liver pathways and stuff first. I'll have them try to get it removed. I mean, if they had 10, that's a lot at one time. I don't know how many they can do at once.
Yeah.
But I would do that trimercury test first to see if that's what the actual issue is. Uh, if not, then I know it's expensive to remove all of those. So if they're showing low on the trimercury test from the oral, I just usually don't have them mess with it because even taking it out will kick some stuff up.
Right.
But if it does show on there, then yeah, I recommend a biological dentist. I start doing the transdermal glutathione, the liver sauce, and then either the Amalga Clear or the Ultra Binder. And depending on how high it was, usually like 3 to 6 months of helping that with the sauna too.
Oh, nice. Ooh,
Yeah.
now random question,
Yeah.
because I was just hearing this recently. Do you like for your female patients to use a sauna if they have breast implants?
Yeah, I haven't really had any issues with that
Okay.
before. So I've had that question asked before. Yeah, I don't think it's really going to cause like anything to melt or anything in there necessarily leach any toxins specifically. So yeah, I don't have any issues with that. Breast implants and they're doing sauna. A lot of the breast implants can cause issues and mold and fungal issues and stuff too, which
Right.
the sauna can also help the infrared. So yeah, I don't see any issues with the breast implants in the sauna.
Awesome. That's good news.
Yeah.
You're still getting good benefits from the
Yeah.
sauna.
I mean,
Yeah.
sweating is going to be beneficial no matter what
Yeah.
we see with research. Even 3 days compared to 4 or 5 days in the sauna, each day you get more and more benefit, through cardiovascular. I think a lot of the toxins are contributing to cardiovascular issues, cancer, Alzheimer's, kind of all of that. So it seems to benefit all of it, just kind of getting your toxins and stuff out of your system. We've
Yeah.
been bombarded more in the last 100 years than ever before. And a lot of Western doctors say, oh, your liver and kidneys and all that can process it out just fine. And like, yeah, but we haven't really evolved to, over the 10,000 new toxins that we've formed over the last, 100 years, whether it's in our
Right.
soap or shampoo or, all of our cosmetics and everything.
Everything.
Even just, our clothes and stuff like that are all made from oil and polyester and all that's going to be more um, it could all be carcinogenic in the body eventually, the microplastics and all that. So, yeah, I
Yeah.
think it's good to do a detox. I do it twice a year at least for 30 to 60 days myself, just to kind of keep everything moving, flowing. It's kind of impossible to avoid everything.
Hmm.
So, yeah, I just kind of do it about twice a year to make sure I'm detoxing myself. Some people are harder than others genetically.
Yeah.
you know, whether they had MTHFR, COMT, some of those genetic variants that prevent them from detoxing very well. My girlfriend has both those. She's like a sponge. She holds on to heavy metals and mold and everything. So it's, yeah,
Yeah.
really tough for her. Um,
She's a
so
canary in the coal mine. Probably.
yeah, exactly. Yeah, she could smell a room right away and tell you if there's mold or something in it. She's very
Really?
sensitive to it. Yeah.
Yeah.
So yeah, there's certain people that have to try harder to kind of keep those pathways open and to keep detoxing. So
Right.
yeah, I would probably do those more. I haven't found like the IV chelation to be quite as effective. You kind of get a big boost right away, and then it kind of fades away.
Mhm.
So I'll usually do like the daily glutathione and stuff like that.
Oh, nice. Do most of your patients, because I know in our office we'll do IV vitamins and like an IV glutathione push
Yeah.
right after, like immediately post-op after their procedure.
Okay.
Um, do most of your patients do the same, or are they usually avoiding the IV vitamin? I mean, it depends on the dentist that
It's
you're referring to.
it's not
Um,
that they avoid it. It's just that that one dose is greater if they go like once, twice a week to get that little boost. It
yeah,
doesn't last in the body all that long.
it's just for right then.
Yeah, and it helps. So I'd like to kind of keep it consistently daily, elevating their glutathione.
Yeah.
So they could still go get like those IVs. I'd still like them to be kind of at a daily dose of boosting it. And then all those toxins go to the liver, get packaged up into bile, and then that goes to your gallbladder. Some people, if they're getting like hiccups, belching, nausea type of stuff, that's more the bile. It becomes sludgy and hard to get out. And so using things like bitters and TEDCA help make that the bile more viscous and easier to get out. And then all the toxins get dumped into the gut, and that's where the binder will bind to it in the gut, help pull it out of your system so you don't reabsorb it.
Love it. Love it. Cool.
Yeah.
Well, I'm curious, did you have amalgam fillings when you were a kid?
No, I've been pretty lucky with no
Really?
cavities or anything.
Stop
I don't know if
it.
my teeth are just, harder or stronger. I remember they put like that coating on it when I was a kid, though.
Sealant, maybe?
Yeah, the sealant thing. But I think it's just, I guess they're adult teeth too, or is it just your baby teeth? Can't remember.
I for sealants, I would say most commonly it's adult teeth, but
Adult teeth,
it's
okay.
like those first adult teeth that you get
Yeah,
when you're like 6 or 7.
so that was
Uh,
about it. And then, yeah, I haven't been pretty lucky since then.
that's amazing. You are
So,
in the
yeah,
minority by
I know.
far.
I
I think
know.
it's like 90%
Yeah.
of the population in the US has
Well, we have a
had.
lot of sugar now, so
Seriously.
it's a
And a
big
lot
part
of
of it.
gut issues.
Yeah,
It's not even just the sugar. If we can't maintain a healthy gut, we can't absorb the nutrients that we're ingesting the way that we should.
yeah,
So we're already not taking in enough nutrients. And then our
yeah,
gut's kind of a wreck, so we can't absorb what we are taking in. So the teeth just can't be intrinsically as strong as they need to be when nothing along the rest of the digestive tract is functioning
yeah.
optimal the way that it should be.
So, what do you think about some of those, like hydroxyapatite and xylitol and all that for cavities and strengthening the teeth?
I actually love both of those
Okay.
ingredients. And they are so controversial right now, and I don't know how you feel about it. But I promise I am digging into the research, and anytime somebody is posting something on social media that they're like, "Oh, but what about this?" and blah 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 blah.
Yeah,
It's I have dug into every inch of research that I can find, and there is nothing that combines the safety and the efficacy of hydroxyapatite and xylitol for oral care products in terms of reducing the risk of cavities and having a really good safety profile.
yeah,
It like we need both.
yeah,
Fluoride has some effectiveness that we can see, but man, the more studies that come out, the more the risk level is showing to be much more than we thought it was a few
yeah.
decades ago. Um, so I don't use fluoride in the practice at all because I feel like the risk
Awesome.
level is just too high.
Yeah,
Um, so if we're not going to use fluoride, then I need some tools in my tool belt. And hydroxyapatite has been used for decades and decades, like as long as I've been alive. hydroxyapatite's been used, just not here in the States as much. It's
Mm,
been used overseas in other countries.
okay.
Um, and the European Union tends to be pretty strict with the products that it allows on the market there, more so than here. Um, and so the EU had this huge study on consumer safety products and really dug in and looked into safety of these hydroxyapatite ingredients in toothpaste.
Hmm.
And everything, they brought up the concerns like, hey, we're worried that the nano hydroxyapatite might be absorbed into the system, might be damaging to the system in some way because the pink stuff in your mouth is so absorbent. Anything you
Yeah.
put in there, you're going to absorb into the rest of your body. And what they found during in this study was that as long as it is the rod shaped and the cone and rod shaped hydroxyapatite crystals,
Hmm.
even though they're nanoparticle, that they are absorbing into the tooth structure really well. So they're having that effectiveness. But as soon as they get injected, not much at all is absorbed, and what is absorbed breaks apart right away into its different materials,
Yeah.
and they're not showing that it's crossing the blood brain barrier like some people have
Awesome.
have
Yeah, I saw that
brought.
concern about the pineal gland or something like that with the nano.
Yeah, I saw concerns about it increasing the risk of kidney stones, and again, no data to back that up at all.
Okay.
So I feel really comfortable with its safety.
Yeah.
Um, and again, it's one of the most effective tools that we have right now if we're not using fluoride.
Do they do like the hydroxyapatite treatments instead of fluoride? Like, 'cause I know then I still put like the fluoride treatment thing in there. Do they have like a hydroxyapatite alternative for that?
They do. Just recently, they came out with a hydroxyapatite varnish that's
Okay.
just a stronger varnish. We use it some in the practice, not a ton. I think it's great for more traditional dental offices
Yeah.
who like they depend on the workflow of doing a cleaning and then upselling with fluoride varnish.
Yeah.
That's how the hygiene department in every dental office tends to work.
Yeah.
And so if that's the business model, then it makes sense that they wanted to create a hydroxyapatite varnish to replace the fluoride varnish for those patients who didn't want to use
Fluoride.
like
Yeah.
the hygienist needed something to upsell.
Yeah.
Um, but we had already done away with that type of business model. That's just not how we roll. So I have it. I do use it some, but it's not just a regular product. Like we're using it strategically. Like, okay, we see this little spot. Looks like it's trying to get a cavity. Do you want us to put some on there before you go? Kind of
Yeah.
situation.
Cool. Yeah, I found a couple companies that have like the hydroxyapatite, xylitol.
Hmm.
Some will put it into the floss as well.
Hmm.
I had one company that sent me, they have it's like a probiotic for your oral biome,
Hmm.
from Super Teeth. That one was pretty good. And then
Yeah.
Calroy just sent me it's like a gum that has like a hydroxyapatite, xylitol, and some like chicory root and some of the other
Oh, I
herbs in
haven't
there.
tried the gum yet.
Uh,
Oh, is that the one
it,
that's so big on Instagram right now? What is the name of that one?
I think it was Calroy. They only have a few other products. I was just at a convention thing a couple weeks ago in Orlando. I think I got it there.
Cool.
But they have Vascunox, which helps boost your nitrogen in your body.
Hmm.
They have another one, Arterisol, that helps with the inner lining of your blood vessels. And then they have another one for cartilage and stuff. And so this is like their
Awesome.
new product. But yeah, that one pretty good too. So I've just been experimenting with these other little things. I do get a lot of questions about the hydroxyapatite though.
Yeah.
But yeah, I think it's been great. I think the other one's Biodent from Standard Process I was using before for helping remineralize and stuff the teeth of
Yeah.
some of these
Yeah.
people. I get a lot of questions about bad breath and stuff too, which I deal
Mhm.
with more of the gut than the actual mouth. And then a lot of people that get sweet cravings could also be more of like a yeast kind of thing, candida, making them crave sweets more.
Absolutely.
So dealing with that too. So
And
it's
we
not
can see
always.
some of that when we do our salivary testing. So I like to test everybody's saliva if
Mhm.
as long as somebody will let me take their spit,
Yeah.
then we'll send it to a lab and we'll test it. But that can really tell us so much about the oral microbiome and tell us what's going on and where things need to be tweaked and where they're maybe a little out of balance. So I love that, especially the test that I use will test for excess levels of candida. So we can see
Okay.
if there's too much candida in the mouth itself, then we know how to treat that. If
Yeah.
there's our particular bacteria out of balance, if the bacteria that help reduce nitrates, so to help with nitric oxide levels, if those
Yeah.
are out of balance, then we know how to shift those. So when we test, we can really make your oral routine very strategic and make your treatment very strategic. Because I hated when I was just a drill and fill dentist, and not really getting to the root cause of issues. So I like being able to see exactly what's going on so I can help you get better so that you don't have to see
Yeah.
me quite so much.
What is a ideal daily routine?
Depends on your microbiome. I would say it does. It actually does depend on your microbiome, but in general, I really like a twice a day routine. So nothing crazy, nothing fancy, and I do find that a high quality electric toothbrush works better than a manual toothbrush.
Mhm.
Um, of course, we could talk about EMFs and all that good stuff if you're sensitive to EMFs. But
Yeah.
an
I
electric
saw one recently
toothbrush,
that's low EMF electric toothbrush. They had, I think, one of these conventions recently. But I have found traveling, I'll bring my regular toothbrush. At home, I have the electric one, but
yeah,
it is a big difference, I feel, of, going back to the old school one compared to the electric one,
it
especially like the far
is.
back teeth and stuff like that.
And even the type of electric toothbrush, there's a huge variety in the quality of
Yeah.
electric toothbrushes. So that's one of those areas where I really wish that I could, get on board with some of the smaller, newer brands, especially the ones that are using more sustainable materials in their toothbrushes. But still, unfortunately, still one of the big brands, the big behemoth, I still see better results from that.
Do you like the ultrasonic ones or the regular mechanical
Sonicare.
ones? The what?
Sonicare. Sonicare is my
Suncare?
my
Okay.
go-to. I know it's not sexy, but
And what's your favorite kind of like toothpaste and stuff?
I'm like you. I try stuff all the time because I want to know
Hmm.
what's out there and what's new.
Yeah.
Um, but there are a bunch that I like. I really like Risewell. Boca has a really good mouth feel to it. There's one from David's in a metal tube that I really, really like. That one is nice because it's still like a pretty strong mint and it kind of feels like a normal, big,
Toothpaste.
big brand toothpaste. Yeah.
Okay.
Um, so I like things that give me a similar mouth feel, especially
Yeah.
if I'm going to ask my patients to use it. Because a lot of them want to switch, but some of the natural toothpaste just don't feel quite the same.
Yeah.
And so I want them to use it. So I want it to feel close enough that they still feel like their teeth are clean and their breath is fresh when they use it.
Yeah. I'll have, I think, like three different like natural ones at home right now. So
Yeah.
go through those, and then the girlfriend usually she's like, I don't like that. It doesn't feel like it cleans my teeth as well as like the Arm& Hammer
Right.
one that she has. So, but yeah, she goes back and forth to that.
Yeah.
I cleans my teeth fine, but she says she still feels a little film on there. So she prefers that one, but I'll try one of these, maybe the David's one
There you
for her
go.
and see if
There you
that
go.
helps a
She
little bit
might like
better.
it. And then definitely we got to use something in between the teeth and we got to use something to scrape the tongue.
Okay.
So
Do you like
brushing,
the,
flossing, tongue
the water
scrape,
pick things at all?
water picks are fantastic. Yes.
Awesome.
And that's one of those things where I'm a realist. I'm very practical in the advice that I give patients. So if we want to get like nerdy and the nitty gritty and what statistically is going to do the best job, then I think all the research is still showing that flossing is still superior. But that's not what I see in real life. Like if you've got a grandpa who's 70 and is has some gum disease, then I want him using the water pick
Okay.
because I know good and well, he's got big old hands, he's
Yeah.
got maybe a tiny little bit of arthritis. There's no way that he's going to be able to floss of the same efficacy that I can floss his teeth or my hygienist can floss
Yeah.
his teeth. So a water pick is just so much easier and can really help with like bigger debris,
Okay.
especially if you've had some bone loss or some recession or any kind of gum disease, inflammation at all.
Yeah. What do you do for like gum recession?
It depends on the cause of it. If
Okay.
if the recession is caused by an inflammatory process around gum disease, then we've got to treat the gum disease and halt the process.
Hmm.
If it is more so like uneven pressure in the bite, sometimes those bite forces, if they're uneven or if they're too strong in one direction or the other, then the tooth will actually flex within the gum line just a little bit, and that can cause recession. So then we got to figure out, why are you grinding and clenching? What are these uneven bite forces? Do we need a night guard? Do we need to do a sleep study? And we kind of have to dig in there to see what the cause is before we decide what the solution will be.
Okay. Cool. Yeah, a lot of teeth grinding and stuff like that. I get a lot of the time. Sometimes it's parasites, sometimes it's stress or other things
Hmm.
causing some of that. So yeah, mouth guards and things. And then what are the two bones that are like in here that they say are from clenching too hard or something like that will cause? Um,
Tori.
yeah, those is
Hmm.
that true? The more you clench, the bigger those get.
Yeah.
Okay.
Yeah. It's same principle. Like we know because we've heard that you help prevent osteoporosis, like you build your bone density by lifting weights and doing weight
Yeah.
bearing activities, right? Well, the same principle applies in the mouth. If you are using your muscles excessively, then you will actually build bone density and lay down more bone inside the mouth. And so if you have tori inside the mouth,
Yeah.
that's just what we call those extra bony bumps in there,
Hmm.
then yeah, a lot of times it is from those excessive forces of the muscles around the mouth.
Yeah, 'cause mine are pretty prominent, and that's what they told me is like you must be clenching or something like that. And I'm like, no, I don't
Hmm.
really clench at night or during the day, so I wasn't really sure why they were so prominent. But I know they're a little uncomfortable in doing like some of the X-ray stuff and putting it in your mouth,
Yes.
and um, but yeah, I wasn't sure if that was true or not from just using the muscles too much or clenching in some way.
Well, I mean, obviously I haven't examined your mouth, but you've got nice dense musculature around like your masseter looks fairly thick. So you've got well-defined muscles. So it wouldn't surprise me if over time you do some clenching and some tensing up at night. It's just not enough that you're clinically aware
Yeah,
of it. But it's something that's happening
yeah,
subconsciously.
okay. And then do like mouth tape or anything like that for some of those mouth breathers?
I do. I think it can
Yeah,
be really helpful. Now I've gotten a caveat. Yes, it is a band-aid, and we want
yeah,
to get to the reason that you're sleeping with your mouth open. That is ideal, but it's an effective band-aid.
yeah,
So it can really be a good stopgap while you figure out um, why you're why you're sleeping with your mouth open. So it can help reverse the habit. If you're able to breathe through your nose, but you just over the years you've developed the habit of breathing through your mouth, then it can help reverse that.
hmm,
And obviously, you want to start in the daytime. Make sure that you can keep the mouth tape on and still
yeah,
breathe through your nose. Those kinds of things. But yeah, it
yeah.
can be a very effective way to change the habit.
What are some of the biggest issues you see with people being mouth breathers? Just that they can't breathe through their nose, or just it's
Biggest
just a habit?
issues like
One that's
in
causing them to be a
adults.
mouth breather.
Oh, what's causing it? Um, Gosh, that is all over the place. So yeah, it could be strictly anatomical. Deviated septum, hypertrophy of the tissue inside the sinuses. So then it goes back to, well, what's the root cause of that? And that could be seasonal allergies, food allergies. It could even be a tongue tie that was just never caught, never diagnosed earlier in
Mhm.
life. So lots and lots of causes of it. but the effects of it are massive, massive impacts long term breathing through your mouth, especially at night. Um, Not just in adults, but even more so in our kids. It actually changes the way that their faces grow.
Yeah.
So mouth breathing
No
is
chin and no jaw and
exactly,
all that, and then more acidic and stuff, right, in the mouth
exactly.
and kind of wearing on the
Yes.
teeth a little bit.
Yeah, it is. I would say when we're talking about kids, especially, mouth breathing is the number one cause of recurrent cavities. When I've done everything, the patient's done everything that we can do dentally. If we've done everything right, we've changed their microbiome, they're doing everything at home that they're supposed to do. If we still can't get them to be stable, to have a stable mouth, number one reason is mouth breathing.
Yeah. Yeah, I've seen that with a lot of kids. The tongue ties will go back to that methylation type of thing. So I'll usually make
Mhm.
sure they're getting methylation support after they find the tongue tie, the stork bite, and any of
Yeah.
that stuff I'll find is going to methylation. So I'll usually get the tongue tie, dealt with and stuff while they're young
Yeah,
to help later. But
absolutely.
yeah, all of that. Very cool. Right. Well, any questions or
Awesome.
anything for me?
Yeah, this was so good.
Yeah, no, I got a lot of
Yeah.
good information for sure.
I think we covered, let's see, we covered root canals, we covered
Amalgams.
cavitations, we covered
Yeah, that's it.
amalgams. We talked about wisdom teeth. What else did we not talk about? We didn't talk a ton about fluoride. Um, so I don't know if you still have patients who are diehard fluoride fans or just can't get off of it because they're
Really,
scared they're
most
going
of them
to
that
have these.
follow me know the fluoride's pretty bad. I think the hardest one to get away from is going to be their water.
Yeah.
So I have like a whole house water filtration system in my house, and then so I pour the fluoride with that, and then
Yeah.
anytime I go to the dentist, it's my friend's wife that does my cleanings and stuff, and she knows I don't do any fluoride, I don't do
She
any of the
knows the
numbing
rules.
stuff or anything like
Yeah.
that either. So yeah, she doesn't ask me anymore. Um, but yeah, other than that, I kind of avoid haven't I don't even know probably over 10 years that I haven't had anything with fluoride in it.
Yeah.
But yeah, I think for the most part, people are aware of the fluoride, the amalgams, but then they don't know what other materials are getting used on, or with the fillings and things like that. What materials are good? And then yeah, a lot of questions about the nanohydroxyapatite and remineralizing the teeth. There's a mouthwash I found before too that is peptide based, and it helps with some of the gum recession. I've had some people use that. That's helped with.
Mhm.
Um, and then yeah, just kind of the mouthwash again instead of doing that, the oil pulling,
Love it.
and what else did we cover? The different toothpastes and stuff too.
I would love if your audience is already, skeptical of using fluoride and everything.
Yeah,
For one, I would like to encourage them. Like you're on the right track. You do not need fluoride to keep from getting cavities. You need a healthy gut and a healthy microbiome to
yeah,
keep from getting cavities. So I would encourage you. You're on the right track. But I would also say because it has not gotten a ton of news coverage at all, but there was a really groundbreaking lawsuit around the use of fluoride in our water supply where some nonprofit groups sued the EPA and they won.
the
But
lower
it
IQ kind of thing.
Yes,
That one.
it doesn't get a ton of news coverage, so I would just encourage everybody
Yeah,
to find, if you want to get on Fluoride Action Network's website, you can, because they post updates. But keep looking and keep digging at this because we know the EPA has to do something. They just weren't given a deadline and they weren't
mhm,
told what to do about it.
yeah.
So it's going to be up to the public to continue to encourage them to follow through on the judgment of this website. I mean, of the lawsuit.
I think they did studies right with they took fluoride completely out of some water in certain counties, and then not in others, and they found it actually increase cavities at all. Quite the contrary, and then they had lower IQs and everything. The ones that did do it. So we're
Yeah.
showing little to no benefit. It's more of a industrial toxin, right, from aluminum or something like that.
Yeah, and I think the fertilizer industry. I think there was a byproduct of fertilizer production that
Mm.
was used. Fluorosilicic acid is typically the type of fluoride that is used in the water supply.
Yeah,
And yeah, and they do over time, they noticed that yes, when fluoride was introduced into the water widespread, that we did have a decrease in cavities in the US. But then when you take a step back and you looked at other industrialized countries, same time period that did not fluoridate their water, they also had a decrease in cavities at the
Yeah.
same rate as
Okay.
us. So we
Yeah, I was gonna
can't
say,
give
when was
credit to
that?
the
What else
fluoride.
was happening? Like we see,
Mhm.
decline in, a lot of these diseases, and they thought it was vaccines. It's mostly sanitation that kind of
Right.
decreased all this, by then. So, yeah, there's definitely other factors in there that could have been causing that, better
Yeah,
nutrition or something.
absolutely.
Yeah,
Absolutely.
definitely.
Oh, somebody asked a question. Somebody just asked, how do you make red gums light pink again? Because the dentist cleaned his teeth, but they're still red. I would say, and that's interesting. Uh, I wonder. I wonder, red gums are typically an inflammatory process. So if the cleaning itself actually caused the redness in the gums, then maybe there was something abrasive that was used that irritated the gum tissue. Maybe the pumice or the paste that was used might have been a little too abrasive. So that could be a potential reason. And then it is, I don't know how long ago
They
the
say how
teeth.
long ago, because if it was like the day after, it might still be a little irritated.
Right, then that would kind of make sense. If we're talking weeks after, then we should probably go back and check that out.
Yeah. I think they had that little laser too before, that kind of after the cleaning, they've like charred some stuff with it before. Last time I was there.
Have you had that done?
Yeah.
Yeah.
Did that
Did it
last
make
time.
did it make your
It did
gums
make it
red?
more red, but I could see it causing some irritation,
Yeah.
some burning and stuff like that there. Um, but yeah, I think it helped.
Good. Good, good, good. Yeah, lasers are great at soothing inflammation and killing bacteria. But yeah, if you use a hot laser and you
Yeah, it was
use
a
it
hot
on the
one.
gum tissue, it can do some damage
Yeah,
for sure.
yeah. So maybe that
But
was what
yeah,
it
I would
was.
say I would say gums should not be red, and if they're red, there's an inflammatory process, and we just need to find out what the reason for the inflammatory process is.
Yeah, great.
Cool.
Well, I think we
Well,
hit
this
about
was
everything.
fun.
Yeah,
Yeah, I know we covered a lot. So go
very
check
cool.
out the lawsuit stuff because I
Yeah,
think
I
that's
will.
super important for us all to keep up with.
Sounds good.
Awesome. Thanks so much.
Yeah,
This was
thank you.
fun.
Yeah, it's good checking in.
Absolutely. You'll enjoy the rest of your day.
You too. Bye.
Okay.